Now, amid the third wave of the COVID-19 pandemic, Nigeria's healthcare system faces a lot of problems that date back to many years or many decades or several decades, if you have to put it that way. Currently, the resident doctors' strike has entered its 19th day. Gross underfunding, inadequate medical personnel, further compounded by the migration of health workers abroad, poor health infrastructure, shortage of drugs are some of the problems that the health system is faced with. What should the federal government do or be doing to ensure that the country's health system competes favorably with global health system? These are the questions on the minds of Nigerians this morning. So Chief Executive Officer, Occupational Health and Safety Managers, Ehi Iden, is here with me in the studio to help make sense of all of this. Ehi, good morning.
Good morning.
Good to see you.
Same here.
Great. I recall that several times we've discussed this issue before,
Absolutely.
but we expect to see a marginal or a drastic change in the system and the approach to seeing how, the health sector can be, revitalized. But in some of the areas we have monitored, things have not really changed. Although some state governments are trying here and there, throwing more monies into the system of the health system, but we're not seeing the significant transformation, that big transformation yet. But talk to us basically from your perspective. What is this big challenge in the health sector?
It has been a continuous big issue for Nigeria and Nigerians. The state of the healthcare system. The truth is, you cannot reap what you did not sow, and that's the summary of it all. And the healthcare system in Nigeria has been undermined by not just those managing it, but by government. But if you even look at what is happening right now as it concerns the striking doctors, it tells you that even within the healthcare systems, there's no harmonization, it's not united. Healthcare system, let's look at it first, not as a medical system, but a healthcare system where you have different professions coming together in ensuring that anyone that comes or has access to a healthcare system is able to live with all the needs met. So it's a chain of different professionals available to manage a system and ensure that the health of Nigerians are preserved. But when you look at what's happening right now, you have several parchments and factions of unions within the healthcare system. It tells you what? That even the healthcare system on its own is factionalized. You cannot have a factionalized system and you expect to have good results. Nurses are fighting for their rights. Doctors fight for their rights. Very soon you have association of hospital chiefs will be formed. So this is not healthy. We don't hear this happen in many countries, but it's only in Nigeria here. Even doctors within the physicians, they have different associations. You see, a house that is divided against itself cannot stand. And this is why government is able to micromanage them. Because there's already that wall of division. They're not together. So government just sees what is wrong amongst the professionals, and government cashes in on that. And that's why the healthcare system we have today is at the state that it is. If you remember, in the Abuja Declaration of 2011 or 2021 or so, it was agreed collectively by African Union and all the presidents of various countries that attended that conference that the budgetary allocation for healthcare systems across Africa should be brought to 2 digits, and that was 15%. And when this was reviewed 10 years after, it was only one country that have succeeded in implementing that declaration, and that's Tanzania. As of today, Nigerian budget is less than 5%. Even in the face of COVID-19,
we just 4.16%.
Yes, but in the face of COVID-19, they just managed to increase to 7%. This is abysmal, and you can't do anything with this. Understand that healthcare system is not just about looking out for diagnosis and clinicalizing processes. No. It talks about research, medical research. It talks about training of medical students. It talks about infection control, being able to track infection before it becomes an epidemic. And these are funds allocation and how to administer these funds in different areas of where we have need in the healthcare system. And this we haven't got right at all. Talking about even the management of healthcare system in Nigeria, I think it's one of the worst in the world, because we just believe we can appoint our cronies into management of healthcare system. But understand the fact that healthcare system is the only place where you make mistakes, somebody goes down. Yeah. It's not like it's not like manufacturing. When you make mistake, you can recall those materials,
or you can replace them.
Yes, or replace them. But when you make mistake, somebody dies. But we treat it with so much. It's something that we don't just know what's going on.
One area of great concern is the number of people, from the report we're hearing, number of health personnel leaving the country in search of greener pastures outside the shores of Nigeria. In fact, from the report we got last week, we're hearing that some Nigerian doctors are even saying, we don't even need to go to Europe or America. If we can go to Rwanda or Kenya or Tanzania, or even if it tells you that it's that bad.
Mike,
talk to us from that window.
It's sad, and you wonder how we got here. Let me share a story with you. I was talking to some medical students that were in their final year, about to leave university. So I'm an occupational health expert. So they were looking at choice of what they can do after graduation. So I was speaking to them. Obviously, these are the opportunities you have. When I finished talking to them, I was going out. One smart young man, it was also a doctor, bedeviled pastor. I ran after him and told me, sir, very good speech, very good motivation. But I'll tell you one thing. 80% of these doctors you're seeing, they're writing their plab. They want to leave the country. So what that means is that Nigeria becomes a place where doctors can be trained cheaply, affordably, right? But it now becomes a country that trains doctors for the Western country. And you can't blame anyone who wants to leave. There was a program that was held in Abuja some time ago where a number of doctors that came back were trying to motivate younger doctors not to leave. But there was this young doctor, he said, yes, we hear you and we hear you clearly. You have left, you are back. Allow me to go and come back to you. So it's a big issue, because medical doctors in Nigeria, they want to work. But how do you work in a place where you are not incentivized? You don't have the materials you need to work. Nigerian doctors are a team of the most brilliant doctors in the world. I mean, we are resilient in anything that we do, but for us just to have the facilities, because no doctor wants to go back home and sleep peacefully when you know that a patient died in your hands, when you know that what you ought to have done, you should have, but you didn't have the equipment, the resource to do those things. And that's why you have the burden of mental health also heightening within the healthcare sector amongst caregivers. So it's a big issue that we need to look into, because until we start to give attention to what is happening in the remuneration, condition of service, workplace conditions, equipment that they have to work with, we'll keep having this exodus. We have not seen the exodus, because I remember many years ago when a doctor was one of the first doctors I knew that was leaving for Oman. He said something. This was as far back as 1998 or 99. He was crying when he was being sent for to go and practice in Oman. He said, but from what he's saying, that he sees many years to come that Nigerians will import doctors from Indians. We're almost at the verge of doing that. But we have people being trained here. When they go out, they perform well. Go to California. The doctors the number of Nigerian doctors in California are more than what we have in the country.
In fact, to add to what you said, in California, for instance, there is a union of Nigerian doctors already in California.
Absolutely.
Which is amazing.
Absolutely.
In fact, it's drawing the attention of the California state government to it, as to, wow, we've not seen this really. We're having Nigerian union of doctors within California. It's really amazing. You know, we used to have instances where even Europeans, other African countries, when they have challenging health issues, they come to UCH Ibadan. At least we've heard that before.
Do you remember, sorry for interrupting you, that even the ruler of Saudi Arabia
has been here before.
Came here for medical care. So the truth is that you ask yourself, between then and now, what went wrong? You know, it's just like the trajectory that we see play out in our daily Nigerian processes. We just allow things to go bad. All that we want to do is see how we can, until we remove that issue of trying to make politicians be at the helm of everything. If you look at it even today, what we have today even in Nigeria healthcare system, we are putting politicians ruin systems. Let's use professionals. Let's because healthcare is a very critical area. Let's use professionals. If you even the latest report I got, bulk of the work that is done in healthcare system in Nigeria are funded by donors. Are funded by donors. Not just that, the funds are even being stolen by Nigerians. So you are funded by donors who see that there is a big gap in your healthcare system. Yeah. They bring in funds to support you, but at the point of accounting for, or did they say return the fund to us? Account for how these funds were used. Where everybody goes silent. I think it's an issue we all have to look at. Nigeria healthcare system can be about the best in the world. We need to give it an attention that it deserves.
Yes. Help us paint a picture for someone who is watching now and who has heard about the challenges in the health sector. Help us paint a picture of what the ideal health sector of Nigeria could have looked like if everything were in place.
In the real sense, if we had all the things in place, really, Nigerian healthcare system could strive to be one of the foremost healthcare tourism destination in the world.
I like the word healthcare tourism.
We have people who are resilient. We have doctors who are smart, who want to do the job. We have systems. I mean, we have systems that have been built. They're not like, I mean, we have high level of infrastructural decay. If we can put a little fund in to just update these structures, we'll have the best healthcare system. Because why? We have the population. Look at how many number of Nigerian doctors that are coming out of school every day. We have the resources. Please, we need, I mean, it would have been the best thing, but we need support. Even Nigerians in diaspora, they want to come, but they can't figure out how they can help within the system. Because it's so, everybody is like colonies. Everybody is trying to see what I can hold on to. We need to open up the space and let everybody come, make it a fair playground for everybody. I give you an example. Some countries found out some time ago that ambulance, government cannot on its own make ambulance available for all the citizens. What they did was they opened up the space for private sector participation. Yeah. Those who know how to manage ambulances, buy ambulances to the system, but put it on that government channel that when you they call for a case to be picked. When you pick the case, bring the bill to government pays. We need to open up the system. Let's have what you call high level of private participation, and this is what we need to do. I'm happy to see the development right now. We are seeing it will shock you that those who are building improving healthcare system in Nigeria are no longer doctors. Many investors, smart thinking people, health economists, people who have concerns towards what's going on in Nigeria are beginning to come together, having consortium of investment, putting up healthcare system. We've seen many that have come up in Lagos, in Port Harcourt, and many are still going to come up. I think once we also will see how we can create an enabling environment. I mean, you can't set up a healthcare system where you have no power. Power is a big issue. So how do you start a complicated surgery and you want to rely on the general power supply? Exactly. It's not possible. So we need to also help, because if these people must bring in their funds and able to support what's going on in this country, they must also have some incentive from government to encourage them in doing the good job that they are doing.
All right. It is good we talk about it this way. However, a lot of Nigerians still feel concerned about the fact that the number one citizen of the country somehow who should, through the body language, because the point there is whatever the head of the country does or says means a lot, and it is word and it is authority. When we have him travel abroad for checks and all of that, although he has the right to as an individual, but that body language, how is it helping or compounding the situation we're talking about?
Mike, it's just like you as a father flying out when you have medical issue, maybe to Spain or to Singapore, and leaving your children here to manage what's available. You don't do that. If you stay here to say, I want my health to be managed here, it shows leadership by example. And I don't think it's embarrassing to Nigerians, though it is right, but it's embarrassing to Nigerians to see that every time our president flies out of the country to go and seek healthcare abroad, what if where you're seeking healthcare you met striking doctors? Will you seek healthcare? And you even left to seek healthcare abroad in the face of the looming crisis in healthcare in Nigeria, where doctors were abandoning their duties. I don't think it's the right thing. If the leaders decide to do what you could look inward to seek healthcare here, healthcare system will be fixed. But because they have an alternative, I mean, do you know how painful it is to see a governor had a dental problem and travels to London to fix a tooth? That's a shame.
Or maybe this is about prestige of, maybe it's that feeling. I don't know. I've not been there, but I don't know what it feels like. But the point there is, for someone to travel abroad just to fix a tooth,
of course, it happens.
Maybe it's the issue of prestige. I don't want them to have access to my dental cavity. So
I think the truth is, we need to give priority to areas where priorities are needed, and one of such is the Nigerian healthcare system. In going forward, if we need to have a future for our people, we need to take the healthcare system along. Let's not forget the healthcare system, when it's running well, is a part of your development indices. It's very crucial because you need a healthy population to build an economy.
Yeah.
And you can't have a frail healthcare system and you want to have a healthy population. We need to focus on this and build it. I understand that the decay has been much over the years, but let's start from somewhere. Let's call for help. Wherever necessary, let's put our hands together. It's our system. We have no other system but this. But we need to look inward and build it. But lastly, the truth is, those that will fix healthcare systems are not in the healthcare system right now. I need us. There are people who are watching and looking what are the problems. There are people that cash on problems and see how they can create solutions.
Take advantage of.
Yes. But what we're doing right now, we are clinicalizing and medicalizing healthcare system, and that is also a very wrong approach we are making. Many countries in the world, those who fix the healthcare systems were not originally from doctors or nurses. If you look at, even go back to the history of when you have, vantage point syringe. The guy who invented vantage point syringe that makes it possible so that people don't have an accidental needle stick injury was not a healthcare person. He was a design engineer. He saw a problem and he looked into it and said, I can address this problem. And he came up with a solution. So the truth is, many people who are not from healthcare profession are beginning to look in. They are the ones that will face this issue. But we need to open up a bigger space to allow private participation in Nigerian healthcare system. Even in leadership, we need to start looking at our leadership model. We need healthcare system. We don't need clinicians to govern the Nigerian healthcare systems, because governance of healthcare is not about clinical service. It's about fund administration. Where is the health fund? Where is it needed? And that's where you can have people having the overview of saying, okay, we need to move funds to infectious disease research. We need to move funds to public health. We need to move funds to infant mortality. We need to move funds to nutrition, because even in nutrition, you need people to. If people are malnourished, children are malnourished in this country, at the end of the day, they are exposed to a whole lot of infections. And when those infections, because the immunity becomes low, and when those infections come, they last longer. Exactly. And these are an integral part of healthcare system. So when we start looking at healthcare system from trying to create diagnosis and curative medicine, no. Let's focus on preventive measures, preventive medicine, because that is the new face of medicine, and which of course COVID-19 has further exposed us to that now. That's the future of healthcare, and I think that's the direction we need to start thinking.
Another discussion or another discourse is the issue of the primary healthcare, where it is the elementary level of healthcare where if you detect or if you prevent or if you mitigate or look, nipping things in the bud before they become complicated. We remember the best times Nigeria ever had from record. Nigeria had the best in the health sector was during the time of Professor Olukoye Ransom Kuti, when he laid so much emphasis on primary health care, and that now is a thing of the past.
You know why that happened? You know why that happened? It brings me back to the point I was making.
Okay.
We're talking about clinicalizing healthcare. Professor Olukoye Ransom It's not even, it's even from the time of Lambo. Lambo was the first that did this thing, then Ratmokusi just followed. Lambo's time, I mean, as a minister of health, was the best we ever had. But understand the fact that Lambo was not a medical doctor, he was a health economist. So this is the point we're making. We need people from those kind of fields, because what you're taught in that area is, look at those people within, I mean, when you have the population, primary healthcare system, they talk about the secondary care, they talk about the tertiary care. The population is, if you manage the population, the mass, they're in the primary healthcare area. So when you manage that mass, you have dealt with a whole lot of issues. And that was the approach that Olikoye Ransom-Kuti also deployed. And all those systems that he built, where are they today? We have carcass of buildings standing, they are not funded. But when he set this up, the impact was felt, I mean, instantly. But one of the issues we have is that we don't also have what you call a continuous process. Every person that comes want to take away a system that was working and enact a new
something
system.
new.
And that's the problem we also have in the healthcare sector that has also brought us to the knees where we are and that we are begging for solution.
All right, we have to leave it here now, and this discussion has to continue somehow, because we have talked about this, and we are seeing some changes in some areas, but we're not seeing enough. So we hope to see that significant transformation in the health sector, the way we're looking at it,
forward to seeing
so that it'll be better for everybody.
Absolutely.
Thank you very much, Ehi Iden, for coming on the program. I really appreciate it.
Thank you so much.
Thank you.
Yeah,
right.